people start to realize our differences aren't as big as they seem.
I couldn't really understand the magnitude of what was going on.
I know a lot of people were affected.
You know, it's still that divide.
From the All Indiana Podcast Network and Wish TV, this is Our City, Our Voice.
You look a lot different at it.
Everybody was kind of spinning about what it was and what was happening.
Everything's changed.
Everything's changed.
A new healthcare facility in Indianapolis is working to break down language barriers and deliver care with compassion. News 8's multicultural reporter Malia Van Ostrand shows us just how the Chin Family Clinic is taking a big step forward in bridging the gap between healthcare and culture for the growing Chin and Burmese communities. Malia.
Absolutely. That having that representation is so important, especially in healthcare. So the Chin and Burmese communities are some of the fastest growing immigrant groups in the city, but accessing healthcare hasn't always been easy, especially when language gets in the way. Inside the Chin Family Clinic, patients are finding more than just medical care. They're finding a place that understands them. The clinic offers multilingual staff and follow-up care in patients' native languages, an important step for a community where many still struggle to communicate in English.
Interpreters are really good for helping us, but we don't have a lot of language that, we use language in U.S. that we don't have it. So it's harder to get it in the right way, what the doctor exactly tell them and instruct them.
But the clinic is also tackling a silent issue, weight gain after immigration. Chin says many immigrants are adapting to American life, facing drastic dietary changes like eating more fast food, leading to higher risks of obesity, diabetes, and hypertension.
Back home, we walk a lot. Right here, we don't do that. We get into the car. Even though we don't have a car, people, drive a bus. So, we don't do physical walking as much as we used to.
Other services at the clinic include pediatric and women's care, urgent care, labs, routine physicals, and IV infusions, which has been highly requested by patients.
A lot of elderly, most people, we think our thinking is different right there. So we think that infusion will really help us. So, yeah, it does help. If they think in that way, it's help them, have more energy.
Beyond breaking down barriers, the clinic hopes to inspire more culturally specific care across the state and beyond as communities like the Chin continue to grow.
Eventually nationwide through televisit. So I now have a license for a lot of states like Maryland. I have and Washington, Seattle, and then Utah, where our Chin people are living a lot there.
The clinic's mission is just beginning with plans to expand services and continue building trust in a community that can often be overlooked.
Discover more at wishtv.com. And when you follow Wish TV on Facebook, check out more podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.